Watching news here on the Rise News. Now, the 24th of October is World Polio Day, a global day to raise awareness and resources for the worldwide efforts to eradicate polio. Communities, Rotarians, civil society, governments, and partners around the world are organizing events to mark the occasion and draw attention to the opportunity to rid the world of infectious disease once and for all, including at a special event at the WHO's European Regional Office with keynote speakers from partners and the Global Certification Commission for Polio Eradication. On the 21st and the 22nd of October, Rotarians and the WHO are meeting to examine how their joint collaboration on polio eradication can be applied to broader public health efforts at an event called World Polio Day and Beyond. A healthier future for mothers and children. Director General Dr. Tedros Ghebreyesus and Rotary International President for the 2022-2023 year, Jennifer Jones, will discuss the work the two organizations have done together for decades to eradicate polio and how they will continue to work together on a healthier future for mothers and children. Here in Nigeria, we have joining us Dr. Tunji Fundo, a physician, cardiologist, and immediate past chairman of the Nigerian National Polio Plus Committee, as well as Joshua Hassan, the current chairman of the Nigerian National Polio Plus Committee. They both will be speaking on how far the fight against polio has been and how can the government help in intensifying the efforts. I want to say thank you very much, gentlemen, for joining us today.
Thank you, Mark.
And we must start by commending the efforts being put to eradicating polio. We know wild polio is at its lowest ebb, but polio still is rearing its ugly head. Talk to us. How far has this effort yielded results over the years?
Thank you very much for having us. I think perhaps a short recap, will do as to how the journey started and how we got here. Rotary, after doing a pilot study in the Philippines in the late 70s, actually from 77 to 79, were able to bring polio to zero in that country. And so Rotary leaders suddenly, had the flash bulb episodes in their head. If we can do it in Philippines, it's not possible to translate that to the rest of the world. And so they approached WHO, as you know, who have responsibility for global health, as to a partnership, to see how they can bring this to the United Nations and to the World Health Assembly so that countries in the world will make it a priority that rather than controlling it, which is what we had been doing hitherto, 1988, making sure children don't get the disease, actually eradicating the virus from the face of the earth so that the need of vaccination will become zero. And that led to the World Health Assembly announcing the eradication of polio as a worldwide priority in 1988. And so at that time, 1,000 children were being paralyzed by the wild polio virus in 125 countries. We raised funds. Then the budget was supposed to be 120 million US dollars. We raised in 2 years 240 million to eradicate polio by the year 2000. We all know polio still has not been eradicated. And the longer it takes, the more expensive it becomes, such that from the initial 124 million US dollars, we have so far expended more than 20 billion US dollars on this. But the good news is we have been able to reduce the incidence of polio around the world by 99.9%. As I mentioned earlier, we're having 1,000 cases a day, which was about 350,000 cases a year around the world in 125 countries. Now, only 2 countries are not polio-free, Pakistan and Afghanistan. And last year, at the end of last year, we had only 6 cases of wild polio virus in the world. So we've come a long way. We've done tremendous work, but there's still a lot to be done. Because as long as there's polio in any part of the world, there's polio everywhere in the world. This has, been born by the fact that barely a month ago, there was polio in New York. Yep. And it was transferred from the part of the world where there's still polio. They found circulating vaccine variant, polio virus, in the sewage system in London. And that is why it is necessary, despite the progress we have made, to reduce the number of polio cases as we've done by 99.9%. We must ensure that no part of the world still has polio as an endemic disease.
So, Mr. Hassan, I'd like to bring you into the conversation. I'd love to find out, because earlier you did allude to us moving to a space where there won't even be a need for immunization because polio won't exist. Is it a little bit too early in the day, possibly, for us to start looking at a world that is free of polio immunization, especially when we see just a few cases you mentioned, but how rapidly they can spread across the globe? And we've learned our lessons from the pandemic, which we've just come out of. Is it possibly too early for us to be thinking about dropping immunizing for polio completely?
You're quite right. You can't drop polio immunization. You can't drop any immunization at all. The whole idea here is you want to strengthen the immunity of children. So if you stop immunizing any type of immunization, you are not going to strengthen the capacity of the children to withstand these diseases. So the whole idea is to interrupt it. And after authorizing to strengthen and with continuous immunization, that is why we are also advocating for strengthening of routine immunization, so that our children are fortified against all these polio and other childhood diseases. You've heard the story of what happened in UK. That's an AFP, acute fluorid paralysis on the human being. Now, that's a case where you find it on the environmental sample. And because you're talking of feces and all that, this thing can go into the environment. And if you see it in the environment, that means one way or the other, it has seeped itself through. Just like we are saying in high brow areas, as long as you wear slipper and you go out and you throw the slipper and you have a small kid, they start playing with it. And you don't know what they will pick up. So the whole idea is, one, interrupt transmission, two, strengthen routine immunization so that all children, grandchildren and co are fortified to make sure that they can withstand that. So question of dropping it does not arise. It's a question of strengthening. And well, to say it loud, our routine immunization record in the country as a whole is far from what we desire to have. And you go from state to state, like Lagos State, for example, is very high. You go to Sokoto, my state, Taraba, and Co is low. So what do? And you have this cross traveling and fertilization of human beings from north to south, from east to west, and Co. So we have to really say it. And like he said, the bottom line is that one child with polio in anywhere in the world makes the whole world not safe, because we used to have a joke that to catch polio is one plane away. I disagree with it. It was discovered that the vaccine-derived issue that happened in Ukraine, you go to CDC Atlanta, they sequence it, and they can tell you who is the grandmother or the father, and it comes from Chad. There is no direct flight between Chad and Ukraine, for goodness sake. So we have to be very careful and take this thing seriously. And so when we lobby the government, we lobby the community, we lobby the parents and say, take your children for immunization. Immunization is safe. It has been proven. What I got when I was a kid looks like AK-47. I've survived it. And so what they're doing now is child's play, and we shouldn't, nurses and doctors know that you give a child a prick and you become an enemy, but that is to save him.
All right, let's try to broaden this discussion. I would like to find out, what did COVID-19 do? Did it derail these efforts to try to eradicate polio? And if that would just give us a scenario of what happened in the COVID-19 period of 2020, 2021, when the entire focus of the world, your partner, the WHO, was focused on COVID-19. and talk to us post-COVID-19 right now. What is happening?
I think, thank you very much, because that's a very, very pertinent question. When I say we face challenges, that was our most recent challenge. We had to pause immunization activities that required us to do mass immunization, mass campaigns, because number one, we don't want to expose both the vaccinators and caregivers and the children to COVID. As you know, movement was rather restricted at that time. So for about 17 months, there was no activity in regard to this program. To make it worse, our routine immunization coverage also suffered because, as you may recall, most health facilities were either converted for the purpose of looking after COVID patients, or families were afraid to go to health facilities because of the fear of getting COVID. So we had a hike in the number of cases, of wild polio, and also we had a reduction in routine immunization coverage. As my chairman just mentioned, our routine immunization average in Nigeria is 50%. But if you disaggregate that 50%, Lagos is about 85% coverage. We need about 90%, such that even if the virus comes into an environment, the children are immunized. But we have states in the north that have less than 20% coverage. It means if the virus finds itself in that environment, we'll have paralysis from the wild polio. We have been lucky so far that our efforts at the GPI, that is Global Polio Eradication Initiative Partners, has helped us to make sure that we have a good surveillance system. Surveillance system applies to every disease. In the case of polio, we have trained officers and we have the WHO who will take samples from the environment. And because we have a trend of where this disease generally tends to occur in terms of population, in terms of water supply, in terms of access to primary healthcare facilities, we know the areas that are most likely prone to generate these infections. So we take samples from this sewage system. When you find it in the sewage system, you know that you are in danger of getting children infected. So you carry out vaccination exercise in that environment as if you've discovered a child, paralyzed by polio. So we stopped that exercise as well. So we had a dip in routine immunization coverage. At the same time, we're not having access to children because of the COVID-19 restrictions, both for interpersonal restrictions and also to movements. But thereafter, we have picked up remarkably well in the sense that more resources have been, put, to play. And again, I think I should mention part of the legacies that the polio eradication effort is leaving behind, both human and material resource, which was brought to bear to assist us with the COVID-19 pandemic. Because we already have staff on ground who are trained to do public awareness creation, communications, assisting the government to mobilize people to get immunized for COVID-19 injections, and to create the enabling environment for communities to accept the vaccine and direct them to environments or critical care centers where they can get help. So it has a positive side, on the program, but we are catching up with the negative side because our routine immunization coverage has started going up again. We have, in Nigeria, between March and now, we've done about 38 outbreak responses. In other words, going house to house to immunize children, using a new polio vaccine that ensures that we don't have any breakthrough infection that gives us the kind of vaccine variant outbreak that he mentioned. So we've picked up quite remarkably, and we have actually tested the legacy of polio eradication during COVID by leveraging on the resources we were using for polio for COVID-19. So we now know that when we're done with polio eradication, we'll have the resources to face other outbreak diseases, as we did also even before COVID. We used that same structure for Ebola. That was how we were able to put a cap on the Ebola outbreak in Nigeria, that we're so lucky we didn't lose so many people.
Now, I'm glad you shed a little bit of light on the situation with regards to statistics, immunization statistics, especially from the north of the country. And I'll just come back to you, TikTok. I'll come back to you. Now, apart from the campaigns where we're going door to door to immunize people and so forth, the north has always had controversy, shall I say, and skepticism, especially where the polio vaccine is concerned. What more can be done to allay the fears of those, not just in the north, across the country? What is happening in order to allay their fears and their skepticism about the potential side effects or the potential, fears around the effects of taking this vaccine?
Well, I think the fears have come down a lot. What has seeped in here is somebody asking you, you asking me to take free vaccination. Why didn't you bring mosquito net around? The other party shared rice and we didn't get it, so we are not going to get this vaccination. You see, it is no more a fear. It is a request. We have something we call in Rotary, we call pluses. That is how we came to support routine immunization with all the antigens instead of concentrating on polio. So the idea now is, if we can match together the fact, and it has to do with health education, and every local government state has a director in charge of health education, to tell our people, we are trying to help you to save the children. We are not here to feed you, but if we get feeding, we can get you. And we give sweets even to children when we meet them inside to encourage them. People even insist that they want soap, alcohol. So it is a psych that we have to bring down, that they're sharing this and all that. For example, the mosquito net, they say, okay, we give mosquito net to families, not less than 2 people in it. They're indirectly saying a mother and child. Then you have a bachelor who insists he wants a net. Now, how do you go about that? So I think the fear part is not on. We have proved beyond reasonable doubt that it isn't something to do with population. We tried it in India. India has been certified free, and they're having more children and more population that they would like to have. The same thing with China. So you can't reason that, this thing has to, and it isn't religious either, because do you know where these vaccines are made? Turkey, and really some of the Islamic countries. Now, so the problem is, we have a society whose psyche, and I don't want to use the word bastardizing, but people have come in and brought in all sorts of things that for you to go out and help somebody, you say, it's like an accident, and very bad accident, and you go to pull somebody out, say, can you find my purse for me? I mean, that's wrong priority. So I think the priority of our population and the lost capable. But let me tell you the one that you would not like to. You know these big gated estates, the senior boys and girls like me and you and this, they do reject vaccination. And you can tell me what? Can you say it's because of knowledge? Doctors too, nurses too. And some of them give you a reason now. I take my child to a high-class clinic for vaccination. Okay. Government gives licenses for schools, clinics, pharmacies. And you go to a school, and the school said, we shan't allow you because we don't have permission. But the rule is, if one child is not vaccinated, he can cause many more children to be vaccinated. So both the low and the high, the intelligent, the rich and the poor, you have a problem talking to their side. I've gone to many missions house to house. You can hear children inside, and they just open the gate and tell you, there's no child here. So what do you do? So above all, this question I'll turn around to you. We should be pleading with you, the media bigwigs, to find in your program, to find in your wisdom, to find in whatever you are doing, to put a word that vaccination is safe. Let's please help our children live longer than us.
And that's the beauty of having this kind of conversation. Right. I want to say thank you for the continuous work the Rotary Club and yourselves are actually doing for humanity, I must actually say. Thank you very much for joining us here today on this day.